So now we get to have fun looking at it and scoring it. So if you, what you're going to do is practice this, and I'm just going to go through these slides where you can see what, in case you didn't remember those slides 5 slides ago. The first thing is you introduce it, then they complete it. We'll talk about the scoring when we, I just need to make sure that I didn't miss anything in the prep here. Okay. What I'm going to do is go ahead to this one so I can talk to you about it. Sorry about all that. I'm going to go ahead to review this, and then we'll go back to the blank page. But if you look in your handouts, you see, do you have one that is not scored yet? What I'd like to do is go in groups of 3. Have you done that before? Please don't worry about it either. Like, no one's going to listen to you, and you're not going to be scored or graded on it. But Tom, thanks for coming to a table, because now you can play. No, don't. Anyway, so in groups of 3, and what I'd like to do is really rather quickly, don't overthink it. Someone who wants to be the home visitor, someone who wants to be the mom, and a observer, avatar. They call that in role plays. You can be any avatar you want. And this is not a test. Here's how I learn. I learn by doing. I'm learning right now. I stumble over my words when I am not sure how to say it. And that's fine. And it's okay if you stumble over it when you're with the mom. But better to stumble over it here. So please don't worry, you're not being judged or tested, but just this is a way for you to stumble over your words until by the 3rd time, the 4th time, the 5th time, it becomes more comfortable. And it's not that you guys don't know how to do screens or assessments, because you do it all the time. What's new is that we're trying to talk about something that has a taboo for so many of us. So what I find is, even though this is my gig, like I do this, I think about this all the time, I still stumble over it because I don't want to upset her. That's just the truth. And the more I do it, and every time I do it, I say, oh my gosh, women love this. So I grew up, as you all did, with the taboo. And I'm still learning, even though this is what I do. My whole life is devoted to this. I'm still learning. Do not be afraid. This is what we talk about. We talk about health, and mental health is part of health, and for no one more important than the new mom. The rates of psychiatric disorders increase triple-fold around childbearing. So when we leave out mental health and the mental health screen, we're telling them, shh, we want to ask everything else, but not this, so thank you for including this in the grant. Did I say I was happy about that? So anyway, what I want to do is go back, stumble over your words, or get it the first time, doesn't matter. But I want someone to pick to be the home visitor. And what we'll start with is the prep. And for me, that's why I wanted to give you a couple of examples, but do it however you want. What I like to start with is saying that just elements somewhere in your conversation that we have a screen that we give to a questionnaire, if you'd rather use that language. I like questionnaire myself. We have a questionnaire that we give to all our new moms, and this is about your moods and mental health. And we know that there are so many ups and downs, pregnancy and postpartum, so we really like to share this with moms because, remember all the stuff I said before, and you can use any of that or something new. A lot of moms find that this gives them language for how they have been feeling, new language, and you might have questions that come up from it, so I'm going to be right here. Now, having said that, there are a lot of different ways to do this, and you'll probably be thinking about it while you're doing your breakout. Should she score it herself, or should you score it? And I don't think anyone has decided this is how we want you to do it yet. Does anyone know? Christy, do you know? So it's all valid, and that's what's important. I find when I'm doing it, I guess honestly I kind of take the read of the mom herself, but What I like to do myself, I just don't want to give too many leads in case you want to do it a different way, but so I'm going to say it, then forget what I said. I like to present it in kind of a non-judgmental, woohoo, we have this questionnaire that's really awesome and great way. And then I say, you can take your time, look through the questions, and then I will give the instructions on how to fill it out. Stumble away, because the first time you say it, I don't know if you feel this, but the first time it's kind of like, oh yeah, I need to make that clearer so she doesn't feel intimidated. I like to give it to her and say, and I'll do it right now so you can all read along. So look at the one that's not scored. And what you want her to know is that, give her a tour like I gave you in the beginning. There's 10 questions. Each question you can check. You want to make a check mark at 0, not at all. If you have you been bothered by any of this for just several days, check next to that, under that column. If you've been bothered by it by more than half the days in the last 2 weeks, so more than 7 days, on average, comes closest to how you're feeling, don't worry if it's not exact. Check in that, so that's the third column, right? And if you've been bothered by this feeling nearly every day, check that column. So that's number 1. And then in number 2, you just do the same. And if you have any questions, I'm right here. So you can, I have a dear friend, Patricia Navin, who is a home health nurse, and what she does is she sits next to people while they do it. It's all valid. I know people who give it to the mom. To me, this would be very natural to give it to her, say, do the instructions and the lead-in, say, take your time, and then I might, play with the baby, or put away some blocks, or I wouldn't go clean the kitchen because that's just insulting. But but I would just hang out and be present, but not. I would not be watching, too much like this, like to make sure she's doing it right. But on the other hand, if you can be sitting next to her or comfortably in front of her, it's fine. But you're present and you're not checking your phone. And I find for myself, if I were that mom, not that anyone gave me any screen, that I only say that because that's my style. I like people near me, but not like on me, So, and Patricia is much more physical, so she likes to sit next to people. And I kind of love that. And I think I probably would have loved it if she had been my nurse. So, and so you could do that, and you can do it however you want, and just make it up here. And you might find you do something that you didn't know you were going to do. So, so the observer person, just observe, and the observer gets to practice your non-judgmental, observational, empathic skills. So at the end, you can say how it felt to you, or something that felt really like, that you wanted to share about the interaction. Do you score it for her or have her score it? It really doesn't matter. I mean, I could pick one and tell you, but you can have her score it. I just don't want it to be intimidating to moms. And it hasn't been decided. So I would say that's something you can go back to your staff and management and ask what they want to do. For some women, technically, as it's developed, the PHQ-9 is developed, it is meant to score it with the patient and then talk about the score. And so what you do then, we haven't gotten to the slides, which is what I was kind of stumbling over, and decided we'll wait till we do this. So we're going to kind of do this in pieces, because the next part is how you score it. And I just don't want to go into that until we kind of do a little run through, just in presenting it and checking it off. So then we'll have a kind of, in practice, it would all be one flow. Here we'll have a stop and we'll talk about it, and then we'll talk about the scoring. Does that make sense? So first of all, let's make sure that you have 3s. We need one more here. Read it too. Absolutely. Thank you for asking that, because I forgot to say. I would probably read it to everyone for myself. And because I don't know, I mean, do you guys know the literacy of every mom that you're with? I'm just not sure. Has this come up already in other trainings? Well, I think there's a lot of words here, and so absolutely. And you can see that we also have in your handouts, we have it in Spanish. Do you see it? So thank you for asking that, Shelley. I would feel very comfortable reading it, and it's all the same validation. It's validated for telephone screening. So, yeah. So you can read it if that feels comfortable to you. And don't worry, this is just one time you're doing it. You might do it different the next time. And it, of course, just a way for you to dig in and feel comfortable with it and see how it goes. So just in terms of the breakout, does anyone have a question about that? So we're not going to worry about scoring yet, but you'll already be thinking about it because there she is. And we don't know, the moms who are, sometimes when you do role plays, you actually get into the role. You don't have to screen it like for real. Let's just say it's not for real, because that's a different workshop. But if anyone needs to talk about depression or anxiety, I'm right here. You can come talk to me. But let's not do that in your breakouts. I think sometimes when you do a role play, the actor people actually do get into it, and you might find that you're saying, I want to know my score, lady. And then you say, well, wait, let's just take a break, because whatever. Okay, so any more questions about just the breakout itself? We need groups of 3. So these nice ladies need one more. Is there a single? And they need, or you could be in a group of 4 if you want. Okay.
I think Pam is coming. Okay. So one of us really is supposed to do the paper.
Oh, good. You have a watch. It's about 5, right? I know.
I don't want to write on it either.
Thank you. I wasn't sure if I'm always go on longer than. This will be fun.
I'll go with anything.
And I knew at the end I'll only do the ones I have time for.
Okay, you can home visit and I'll do.
Okay, thanks. So nice. I wish I was first of all, this is the president. Come to see it here.
I'll start with the last question that was asked of me, and I love this question. The mom in this group was answering it, but really she was answering it, and she said it was situational. It wasn't hormonal. So she was concerned, is that still valid? Because it was really more that my husband left at 7 months pregnant, and that's a crisis. Is that still valid? So think about it for a minute.
I know that one came up a lot. I know within in my own family, and my mother would use that a lot of the time as her excuse, like when doctors or doctors it's situational. But for the most part, from what I've learned, most depressions are situational. Something happened that caused whatever hormonal imbalance or just mood imbalance within you. So
excellent. And the truth is, they promised I could come back next year and do more of a training on what we're talking about, because we're starting with screening. But to the extent we can, I'll talk about it today. But it's the causes of postpartum depression are multi-factored. It is situational. It's situational, and it's physical, and it's psychological, and it's cultural. So remember, but probably I'm trying to keep myself corralled a little bit. Most important for this training is this is not a diagnosis. This is not a diagnosis. This is a screen. So think about your role play. You want to move into the assessment. You just do. That's why you guys are home visitors. You want to. But it's a screen. And please remember that, because it takes some pressure off of you and her. So the person who presented it, you probably were you start that way, but then as soon as if you have a real dialogue, it starts to feel like an assessment, a diagnosis, and it will. But I just want you to remember, especially for this question, well, it was situational, not hormonal. Perfect, that's what postpartum is. You just nailed it. That is exactly why women have higher rates, because it's situational, physical, cultural, emotional, spiritual. So
what do you tell the mom that you're going to do with this piece of paper that you've had her fill out? I would think that would be a question of who are you going to
thank you. Yeah. Thank you. That probably came up in your introduction, or you at least thought about it, and that happens for me too. You need to check with your agency. I can't give you that answer, but I would, ideally you would say, the answers you give me are confidential. I will share them with my supervisor, blah, blah, blah. I don't want it because I don't know what each agency is doing. Please go back and ask that question. But absolutely, she needs to know it's confidential, and that also, but I thought you were also asking, maybe you were, what will you do with the answers? What I would say is we can just look at this together and look at what you come up with together, and then see what if I can be helpful to you. So I thought you were also asking that, what do you do with the score? But then who do you give it to? Every mom wants to know that, so it's kind of important. And what I would say, if I'm giving it in my own setting, I would say this is confidential between you and me, and there's more training on that, especially because you really need to say, if there's a question of harm to yourself or your baby, that's something I need to share. But I understand the difference between fearful thoughts and risk of harm. So I want you to know that you can share if you have scary thoughts, and I know how to ask you and help you figure out if you're at risk. That's so important. And hopefully, you know, like you said, I could come back next year and do the rest. But for the sake of time, another really, several great questions. What about dads? This is completely valid for dads, for men. So the PHQ-9, I should say, is not specific to postpartum depression. It is specific to depression. You can use it with moms, dads, teenagers, avatars, and you can use it on the phone. So Shelley asked that before. And then you asked a question, and now I don't remember what it was, what you were asking. Somebody was asking me a different question. No? Wait, that was a quick one. Were there other questions? Yes, thank you. Thank you. She asked, what about, like, you have the picture of the mom who looks really great, but she was actually severely at risk and depressed. Actually, she was psychotic, that woman. Or what about the opposite, where you walk in and everything in you says she is having trouble. She looks depressed, she has flat affect, she's not interacting with the baby, but she says, I'm good. Well, I could spend hours on that one, God. First of all, please remember cultural differences. Okay, you know, we don't know unless we ask, and we can't assume. So she might have flat affect, and she might interact with her baby differently because of her family or her cultural norms. So we don't know that. Secondly, though, I just said, give her the brochure anyway. And if you, wherever you are, if you're in Portland, I think, yes, as you said, I guess I should give that to everybody. I hope so. You can call Baby Blues Connection, and they'll send you brochures. Or you can download them and print them from the website. If you're outside of Portland, Well Mamas, you know, Klamath Falls, you had Deschutes, they all have brochures now with local numbers. So give it to everybody. That is my opinion. And but what I was saying, in particular, imagining that mom, is leave it with her anyway. Let's imagine, because let's assume she is depressed and she's kind of trying to put on a strong front. There's every reason in the world that she's doing that. She's scared, she's prideful, her husband told her. She's trying, perhaps in her culture, to be a good mom, a smart mom, to not reach out for help. That would be wrong for her. So what I would do is I would leave the brochure, and I would not push it, because that's not really motivational interviewing. Wouldn't say, like, you know, honey, I can see that you're depressed and you're not playing with your baby. Like, we want to say that, but really we want to say, you know, I'm going to leave the brochure with you, and you can read it over. That's actually what my doula did with me. And if you have questions, I will be back whenever it is, or you can call me. This number is great to call. You know, you can call for anything. You can call, remember the mama I told you about from the Salem area? You can call if you have questions about the baby. And because sometimes the moms that you were kind of describing, they're more likely to call with a parenting question than I need support. So go for it. That's fine. And the thing that really your eyes lit up when I said this is you wouldn't believe how many times women say to me, the first time she asked, I said no. I was waiting for her to ask again, and she didn't. And that was news to me as it was to you. It was like, oh, because we're so afraid of offending her by repeating the question. She might be waiting for you to ask again. They go home from a doctor's appointment, or you leave the house, and next time I'm going to say yes. Next time I'm going to say yes. Mm-hmm. And so don't be afraid to ask again or do the screen again. There's nothing wrong with that. The worst that happens is they get mad at you.
We just tell women that we're going to ask it a lot.
Mm-hmm. That's great. So I want to ask more about your experiences, but you know we can't finish without talking about scoring. So first of all, this is getting a little bit into diagnostic, but I want to tell you that this is how it's used. Is when you look at the two columns, the two left columns that are shaded on that one handout, it's considered a major depressive disorder if there are at least 5 check marks in any of the 2 right columns, and one of them has to be those first 2 lead-in key questions. That makes sense? So that's just a really quick, like if one of the yeses is one of the first 2, which is the PHQ-9, and there are at least 5 check marks in those 2 right columns, that's considered major depression. It's considered an other depressive disorder if there are 2 to 4 check marks. That's not, a lot, but it's considered a kind of depressive disorder if there are 2 to 4 check marks in the 2 right columns. And one of them is, have you felt depressed or not interested? You do have to rule out other causes. Grief, history of a manic episode, or physical disorder. So when you get to scoring, and this is how I said in the beginning, that wake up the left side of your brain, you don't just add the columns. What you do, look at the score, the page that has the blue. Thanks for printing in color. You guys are awesome. That's just so much easier. What you do is you score the last 2 columns as we talked about. And you see on the first one, the diagnostic symptoms is the blue handout, and the severity score is the next one, which is in yellow. So just when you're figuring out the total number of symptoms, the diagnostic symptoms, you add up the score in those 2 columns. And if you look at the handout that has the score at the bottom, do you also have that? Looks like this. And so it has where you can kind of do the math on it. What you want to do, and again, don't worry about the math because you can learn this over and over. I'm showing you this one that's in the next little packet, and there's one in English and one in Spanish. So keep going past the color pages. So anyway, you add up the columns. So let's say she has checked 1 in column 1. Well, we're just going to use this one to score it, of course. Let's say that they've checked now. Is this that group? Oh, look at that. 1 in column 1. That would just be a 1, right? So you would put a 1 in that gray box there. Here, you want to add up how many 2s she has. So 2, 4, 6. So in this box would be a 6. And here she's got 3s. 1, 2, 3, 4, 5, 6. So that would be a 6. And that gives you your total score. So for this one, when you add those all up, and you have, hang in there with me, 1 plus 2, 4, 6, so that's 7, plus 1, 2, 3, 7, 8, 9, 10, 11, 12, 13. And so the total number of scores goes here. Total symptoms, excuse me. When you want to figure out the severity, oh, I did it backwards. I'm so sorry. What that's see what I mean about my head? And you all knew it too. Okay. That's the total number of boxes. I take it all back. So you put all, forget what I said, take all the total boxes in all the shaded areas and you put that there. That's the total number of symptoms in the shaded. So 1, 2, 3, 4, 5, 6. 6 symptoms. So right here, if you forget, count the total boxes checked in all shaded areas. Enter the number of boxes checked as symptoms. Right there. So all you're doing is the number of boxes. I see how I always mix it up. The total score is now on the yellow page. And that's what's going to tell you how severe she is. And that's where I was doing the silly math, and I apologize for that. So on the yellow, you have to add up all the boxes, which I wasn't doing because I was on the wrong page because it's gray. Okay. So severity on there, this is where you add up the scores. And so that's going to give you the severity, and that's 16 on the practice one.
So you include
That's right.
the several days on that score.
That is right.
Okay.
On that score, that's when you look at that, you include the yes.
So for the total score,
Is people trying to get everyone to stay in this one conversation, and probably the question that you're about to ask is something that others might want to hear answers to. So if I could just ask everyone to stay with
Thank you. Excellent moderating. Yes. Go ahead.
so we got lost on the score.
Yes. Like I said, don't worry. This part you can learn over and over. When you go back, and if you have questions, we can go over it again. The first thing you do is add up the diagnostic symptoms, and that's what they call the total number of symptoms. And that you just count the total boxes checked in all the shaded areas. That would be the last two columns, and I, or thoughts of hurting yourself. So in this one, all the number is 1, 2, 3, 4, 5, 6, and you put it there. Now the total score, you ready?
Yeah.
Go to the next page, which is yellow. And this tells you severity, and that's what they use to decide the level of depression. Now with the total score, now you include, right, like you said, anything that was checked. Are you all with me? And you add it up. So in column 1, this is several days. You have 1, 2, 3, 4. So 4 plus 1. In column 2, this person, case 1, Janet Rogers, 1, 2, 3. So, but it's at the top, it's 2. So you want to do, there are 3 boxes checked in this row. So it's 1, 2, 3, 1, 2, 3, 4, 5, 6. Right? So 3 times 2. And nearly every day, that's 3 at the top. So that one is 3 times the number of boxes. 2 times 3. That adds up to your total score.
Thank you.
Yes.
This might seem like a really silly question.
Not at all.
Looking at the different sheets that you've handed us, the one that we were using for the scoring, that's right in front of the Hispanic, or the Spanish one,
Mm-hmm.
that format is different.
It is different.
And so are the English ones now formatted the same?
No, don't read it that way at all. Your agency needs to decide what's going to be on the page.
Okay, so
It's not that it's English and Spanish. It's just that English one happened to have the scoring boxes on it. And I am happy to be in touch with the different agencies to figure out what to download and what to use.
We were just noticing it doesn't have a total for the symptoms. It has a total. Is that the total severity or the total symptoms?
Isn't that confusing? I'm serious. That has been really hard for me too. And when, again, that is something that your agency really needs to be clear on and to say to you, but when you're looking at the one, for example, that just has the total there, it really should be totaling. You're going to have to decide that. I don't want to say something and then have, if they decide something else, that won't be nice.
Total symptoms and total score. This one gives you both options.
Yeah.
This one just says total.
Yeah,
Right.
so the total on the one that's shaded, how I would use that, but you guys are going to decide on your own, is by doing the severity, this one. I would do it like that. Because that's, as you'll see on the next slide, which I have to get to, is what they refer to when they're trying to say what the proposed actions are. So if you have questions do you have a break at 2:30 or you go right into the next? Okay, if you have questions at the break, I'll be out there. So then when you look at that score, this is what is validated. 0 to 4, depression severity is none. 5 to 9, mild. 10 to 14, moderate. 15 to 19, moderately severe. And 2 to 27, severe. The proposed treatment is not important to how you're using it. You need to be able to do the screen, score the screen, and you will see, but so that third column, whether they take meds or do therapy, that's the next step. But you in your agency will decide what do you want to do with each of these segments. Any score, this is the recommendation, more than 5, you want to talk with her, reflect, use all those skills, reassure, give her educational materials, give her the brochures, tell her we live in a wonderful state to reach out for help because we have a great support network here for new parents. And then you follow up with her. If she's got a score greater than 20, you need an immediate initiation of treatment. You want a quick referral to a mental health provider, and if you don't know, find out how to refer her, and that's going to be something that you're developing as you go along, and facilitate that. I have at the end of this PowerPoint resources to help with that. So I'm going to breeze through that to the end. There are questions here about just a follow-up, but this isn't part of screening. It's part of assessing. And you can see that these are typical questions for any follow-up. In the 9th question, if she scored anything but 0, she needs immediate help. Maybe they're just thoughts, and maybe this came up for you in your role plays, but you want to know, when you think about this is really hard as a home visitor, but the question for you isn't what does she need? The question is, what's my role? What is my role in helping her find what she needs? So find out where your support is. Do you know the emergency services in your county for mental health? And if you don't, find out, because that's what you want to make sure you come into the home with. She needs immediate assessment. And yes, I'm sure, and I heard people saying this in the role play, we understand that thoughts aren't the same as plans or actions. But it's really important.
Assess immediately. If someone scored a 1 on that, that would be...
She needs some kind of
assessment by mental health? Is that what you're saying?
That would be an assessment by mental health, not necessarily a crisis she needs to be in the ER at all. But if you have a mental health consultant to consult with, yes, you need to make that connection. So just documenting, again, that's really agency by agency, but you want the date, which is, I know you know, important in everything. And also write down, did you give her suggestions or guidance? Because that's going to become important for follow-up. Did you give her educational materials? And I would make a little checklist on this. Did you make a referral? Did she refuse the referral? And as I said, I'm not going to talk about causes, but of course, you know that I would love to come back and talk some more. They're laughing at me. Isn't that great? So what I want to make sure we do is talk about the resources. Postpartum.net/gethelp tells you where all the volunteers are in Oregon. We have 8 of them now. And there's a new Oregon Health Authority website. Did you know that? For perinatal mental health. And please go and look at it. It's fantastic. And that's in your PowerPoint. You can show them the website. There's a parent brochure you can download from the website, which is in English and Spanish, the DVD, and HRSA also has a wonderful brochure. These are some online resources also in your PowerPoint. And I think that what's most important is that if you know where to follow up, they will also know where to follow up. The other thing that we have here is a risk factor checklist that if you look at that and have questions, I'd be happy to help you with that. The last slide, your first steps after you do a screen, if you feel like, okay, she is screened, that she needs some help. You're going back to listening to her without judgment, encouraging her. This is a good place to reach out and helping her find support. So in the 1 minute we have, what questions can I answer for you right now about all this? Yes?
Would you be willing to put back up that documentation slide? It's not in here, right? You just had a great slide on documentation.
Oh, I'm sorry. Perhaps it isn't. It's just the slides are, I did add some, so yeah, you bet, you bet. Any other questions? And really quickly, anything else from the role plays? Was that helpful? Avatars, what did you notice? What seemed most helpful? The observers of your role plays. What was the hardest? Just how to present it? And did the people who played the moms have any tips for the rest of us on what would be helpful and what was not helpful? Yes?
I was an observer, but she mentioned and reminded the client of confidentiality, that she wouldn't be sharing this without her permission. I thought that was nice.
Really good. And that question is also individual to each agency. So ask about confidentiality, ask about emergency resources if you don't have them. There's a mental health crisis hotline is what I give. And anything else about from the breakout? Yes?
Just a question. Do they have to be asked in order, the questions?
Yes, they do. Excellent question. They do have to be asked in order. It's really specific, the order, in fact. And they're really technically grouped in symptoms, the first two, second two. Yeah.
Well, we just had a question about reading through the questionnaire. I'm going to read it through, tell them we're going to read through it, and then you can fill it out on your own.
Perfect. Absolutely.
Rather than reading it through and having answers, I'm going to give you an overview and read through. And then
That's great. I love that. That's a great compromise. So you did both. Yeah, so did you hear what he said? The way they present it is we're going to read through it together. And did you read it out loud?
no, ask about reading it.
I meant you would have if you were in the home.
Yeah,
Read it out loud and then give it to her or him. We're talking about dads. Also, adoptive moms, high rates of postpartum depression too. So this can be used with moms who adopt or foster moms or grandmothers, anybody. Yes?
well, I think you mentioned that earlier, but making it clear that this is not the only time you're going to
Yeah.
hear it, so that the pressure's off you too.
Yeah. So with respect for staying on time, thank you so much. And if you have questions, my contact info is on your last slide. And of course, I'm happy to answer questions or help you find resources in other languages or anything you need in this. Thank you.
Thank you very much, Wendy.